So, without much ado, we will go on to our next speaker. Today is really packed with knowledgeable persons, and it's another opportunity to gain more info on the theme for today. So, our next speaker is Mr. Francis Akinkunmi. Francis Akinkunmi is a seasoned and practicing clinical psychologist of repute, a minister of God with a high passion for integrity and excellence. He holds a bachelor's degree in pure and applied psychology, master's degree in clinical psychology, and at present a PhD student in clinical psychology. He's an astute researcher, a clinician with many years of experience in the psychological assessment and management of children, adolescents, and adults with emotional and behavioral challenges. And he has successfully managed patients, including but not limited to those with fear of flying in aircrafts, patients with depression, anxiety, substance dependence, as well as individuals with sexual trauma. Being a trained clinical psychologist, he has successfully counseled many prospective couples planning to go into marriage, and as well as ameliorate many psychological distresses among married couples through couple therapy. He has presented and discussed many psychological issues in many fora, including the popular channel television program and radio program on mental health. He is a registered and licensed member of Nigerian Association of Clinical Psychologists. He is the coordinator of research work in the Department of Psychology, Federal Neuropsychiatric Hospital, Yaba, and at present an assistant director of psychology services, FNPH Yaba. He is an emotionally intelligent, driven personality with an unequal and unparalleled empathic attributes, good leadership skills with passion for mentoring younger people. He is the author of a book, Living Well and Health with Emotional Intelligence, which looks into the cultural and psychological perspectives around emotional intelligence. Due to his passion for excellence and value addition with deep experience in child and adolescent management, he has also completed another book titled The Backbone of Child and Adolescent Psychiatry, The Team Approach. He is happily married to barrister Bolanle Akinkunmi, and the marriage has been blessed by God. Please, let's welcome Mr. Akinkunmi. Please let's put our hands together for him.
I want to say, all protocol duly observed, it is my pleasure joining the noble profession and noble personality here this morning to deliver this presentation, Attention Deficit Hyperactivity Disorder and Dyslexia. I am going to be speaking from the psychological management. I have a slide, and I'm expecting that very soon it's going to come on board. And will be okay, it's already up there. So I am highly impressed and delighted to be here. I have a short time to present, and within that short time, I'm going to deal with the aspect that has to do with the psychological dimension in managing children with this condition. I work as a person for years, and I think I will have to move a little bit because I have to speak to the slide, and I want every one of us to move along with me. So as I said, I've worked for many years within children with ADHD, with children with dyslexia, and so many other conditions. And this morning, it is my pleasure to let us understand that these children, no matter the disability we may say they are having, they have a lot of strength. One thing is the diagnosis, but what psychologist is actually looking for goes beyond the diagnosis. How are these individuals dealing with the psychosocial challenges associated with these challenges. How are the caregivers? Thank you so much. The caregivers, the parents, how are they dealing with this condition? I quite understand that majority and many of my other co-presenters, they are going to still talk more on some of these things I have on the slide, so I'm not going to spend much time on them. So, when we talk of ADHD, when the question was raised, how many of us have seen such a child before? The number of people who have seen them were very few. But, like I said, I have worked with these children for many years. ADHD, which is called Attention Deficit Hyperactivity Disorder, is a condition whereby you find children unable to sit still like all of us are sitting like this. I think this is the best example I can give. All of us now are seated. You are looking at me. You are attentive. A child with ADHD cannot do this. They are always on the go, jumping from one place to the other, jumping from as if someone is pursuing them. As if there is a nail already where they should have used to sit on. They cannot just sit down. This is a typical nature of a child with ADHD. And one thing that is very important is that this individual, when you look at them, just seeing them, they have the same physical characteristics like every other individual, but this behavioral issue, jumping from one place to the other, is something that is very common. Quickly, some of them have challenges with inattention. So we have 3 types. There are some of these children, their own problem is inattention. They are easily distracted. They can't pay attention. It's still part of ADHD. This kind, they are called attention deficit disorder. They have attention deficit. They are easily distracted. You are teaching them, they are already thinking of another thing. They are not looking at the teacher. They cannot just pay attention. There are some that they don't have problem with attention. Their own problem is hyperactivity, impulsivity. They jump from one place to the other. They are very impulsive. They act before they think. The third category are those who now have combination of inattention, hyperactivity, and distractibility. Now, there are characteristics you see. Next slide. There are characteristics you see that can let you know that, a child has what is called inattention problem. These children, they cannot focus. They cannot concentrate. Some other thing you find among them is that they're having a short attention span, making careless mistakes. Most of them are very forgetful, and if you give them a task to do, they will just abandon it within a short period of time. Those that are having hyperactivity, they cannot sit still. They are constantly fidgeting, being unable to concentrate on tasks, excessive talking. These are symptoms and many other ones that I think many of the other presenters could also talk about. Now, do you know that this condition can also cross to adulthood? There are adults, many of us might have seen them. They cannot just stay in a place for 30 minutes. They will always be moving from one place to the other. Now, ADHD in adulthood must have started from childhood. If this condition is seen in an adult, it's not ADHD if it has not started from childhood. So most of the people who has it or who have this condition during childhood, probably they were not managed. Probably maturity does not take it from them. They have a carryover to adulthood. These are people that are likely to drive recklessly on the road. They cannot be on a queue. Every one of us want to be on a queue, and we want to take food. You see them, they will jump queue. This could be as a result of ADHD. There are a lot of risk factors that can cause it, that can make somebody to be vulnerable to having it. For example, if somebody have a premature birth or low birth weight, or the mother has challenges, probably having illness or sicknesses during conception can lead to these and many other things. Now, let me talk psychological now. Where does psychologists come in to help this individual? How do this individual, despite whatever challenges they are having, come to function very well despite that challenges? So psychologists, when we see them, we are looking at so many dimensions of their life. And one of the things we do is to conduct detailed clinical assessment. This detailed clinical assessment, we expose the psychologist to the psychological world of this individual. In other words, what are the psychosocial challenges that this individual is facing? Children with ADHD, in the process of conducting interview for them, you want to look at what are the issues this individual is facing. Are there issues with stigmatization? Are there issues with bullying? Are there issues with low self-esteem? Are there issues of poor self-concept in this individual? So the interview will look into this dimension. Beside that, the interview is also expected to look at the aspect of the caregiver who is taking care of this child. It is important for me to quickly let us understand that sometimes ADHD does not come alone. Sometimes it comes with dyslexia. Sometimes it comes with autism. Sometimes it comes with intellectual disability. Am I communicating? Are we connected, please? So look at a mom, a parent that at the point of having this child, everybody came to celebrate with this mom. She was rejoicing. She was happy. A new baby has been born. Only to find out that this child is not doing well like other children. What do you think will be running through the mind of such a woman? Will she be happy? Do you think she will be glad? And so when you see some of these caregivers, they came to the clinic, bring their children, some of them are distressed. Some of them are unhappy. Even the burden of care is much. Even before this period in time, some of them have had delayed developmental milestone. Those children, sometimes they have delayed developmental milestone. They are not walking at the right time. They are not crawling at the right time. They are not speaking at the right time. And so sometimes this delayed developmental milestone with other conditions can lead to attention deficit hyperactivity disorder. So when this individual comes for treatment, you want to also conduct a detailed assessment of what the mom or the dad or the caregivers are going through so that you can plan appropriate intervention. Beside this, psychologists is also going to use what is called standardized tests, screening tools to actually know the level of that disability. Is it mild? Is it moderate? Is it severe? So beside the detailed interview you are conducting, you are also doing comprehensive psychological assessment. And with this assessment, you can also get the level of this disability. Now, in managing these people beyond the assessment, what other things will the psychologist also do? The psychologists, among other things, want to carry out behavioral intervention. Like it is, and which is the gold standard, when an individual is having attention deficit hyperactivity disorder, you don't just bring the patient to the hospital and be giving them medication. No, it is wrong. And one of the beauty of this training or this workshop is that we may have people here who do not have these children in their custody. But you know people who are having these children. Another thing again is that someone may be a teacher here who is teaching such children in school. Another very important thing is that there could be parents here who are having family or who are having children with this condition. Never allow your child to be given medication immediately once they are having this condition. You should allow psychologists and other health professionals to work on this child first and foremost. Medication should be the last option. In fact, sometimes medications are not needed, especially when it is not severe. Last week, a woman brought a child, a 4-year-old girl, to the clinic. This child was not doing well in school, and as a result of that, she was referred to come to the clinic. So the first thing is not giving that child medication. This child is not having impulsivity, is not having hyperactivity. This child is only having distractibility. Sometimes she could not pay attention like other children. And as a result of that, this child at that point in time is not somebody that should be given medication, because the medication side effect could worsen the condition. But rather, professionals like psychologists, occupational therapy, especially if it's a child that has grown up like 6, 7, 8, could go a long way in helping such an individual. So what are we talking about here is a behavior modification program. Is one of the tools that psychologists use to modify that behavior. If it is hyperactivity, what can be done to this child to keep this child still? And when a healthy behavior is exhibited, you reinforce that behavior. Anything the child does that makes the child to carry out a desirable behavior, reinforce with a reward. Over time, with positive reinforcement, this behavior, which is a healthy behavior, can be repeated. In other words, if the child sits still for 10 minutes, you are sitting still, both of us are sitting here for 10 minutes, and that child cooperates, and for 10 minutes sits there. At the end of the 10 minutes, you can clap for that child. At the end of that 10 minutes, you can give a reward, something that the child will admire, something that will make this child happy. It could even be something that will make the child to be happier within. Over time, with repeating the exercise, could go a long way in helping this child to promote healthy behavior. There are some situations whereby it could have been a grown-up, it could be an adolescent, and because of the challenges they are going through, they are now having comorbid conditions like depression, like an anxiety. Cognitive behavioral therapy could be used. It's a psychological therapy for changing irrational belief system. Like a child who is seeing himself as not good enough because he's having this condition. Self-fulfilling prophecy. People are saying you are not good. You are odd. You are disabled. You are different. And over time, he's internalizing it. He could be developing some emotional problem, and cognitive behavioral therapy could go a long way helping to address this. Another thing that psychologists will do is what is called parental training and parent support program. Like I said initially, because of our society, there are a lot of parents having these children, they do not even understand the condition. And in fact, some people will tell you it's a spiritual attack. They will tell you it is because somebody attacked them in the womb, that is why this thing happened. You know, the fear of unknown comes in. Psychologists can correct this kind of belief system in them that is very distressing. And beyond that is that you want to psychoeducate these parents about the nature of the condition. What is ADHD? How does it manifest? What are the symptoms? You psychoeducate them. It goes a long way in helping. Now, another very important thing that can also help here is a collaborative approach. It's not something psychologists can do alone. So there are other professionals that come together to manage this condition from their own professional perspective. So psychologists can also work with these other professionals to help this child to achieve improvement, like occupational therapy, speech therapists, even nurses, even pharmacists in some cases. Because like I said initially, if the condition is so severe, there are severe cases whereby some mild medication can be given. But it is exceptional cases when the condition is severe. Now, beyond this, it's also important for us to know that children with ADHD, you will see that I didn't mix them up with dyslexia because it's a unique condition on its own that must be managed in an individualized way. So it is someone having this condition should be managed, putting into the consideration the challenges of that child. So when the assessment is done, you find out the needs of this patient, and you can now develop a treatment plan that is individualized, focusing on the area of challenges to be addressed, to be minimized, to be ameliorated, and also looking at the area of strength of the child that can be built upon to help this child to achieve improvement. Now, because of time, let me go to dyslexia. I am sure many of other presenters, my co-presenter, will still talk more on it. When you talk of dyslexia, this child is a normal human being with potential, but anything that has to do with reading, anything that has to do with spelling, anything that has to do with writing is a challenge for this individual. They find it difficult to read. They find it difficult to write. They find spelling words difficult. And when you look at this kind of situation, you are likely to look at that atmosphere in a class where everybody can read. And you know children, everybody in that class can read. And here comes a child that cannot even articulate words correctly. Anytime it comes to reading, hides his or her head. Anytime the teacher is saying, tomorrow we are going to do comprehension, we are going to read, he is already fidgeting in the class. He's already uncomfortable. And you know, if at all costs the teacher now say you must read, oh, come and see a lot of jargons, a lot of difficulties, a lot of sweating in the class. And you know children, they will make fun of that child. They will laugh at that child. They are going to mock that child. And when this individual goes with these challenges over time without being managed by professionals, it can worsen the condition. And that is why it is important that managing these children, this situation becomes important. The situation could be mild, like ADHD, it could be moderate, and it could also be severe. I will appreciate that the slides is up so that our viewers can see and they can also follow. Now, when it is mine, you may not notice much challenge in the classroom with them. But when the situation is becoming moderate, in other words, the reading, inability to read, to spell, and also write is getting to a higher level, it has a lot of psychological challenges for them. Now, when the situation is severe, in other words, they cannot even read at all. Spelling is difficult. Just tell them to spell the word beautiful. You are going to see a lot of jargons they are going to say because it's a problem for them to do that. Now, in this situation, how does a psychologist come into helping them? One thing is the strength-based approach. Now, in getting the strength-based approach, psychologists must conduct comprehensive interview. And this interview will look at into different dimensions of this individual life. What are these dimensions? You want to look at what are the emotional and behavioral challenges this child is going through. Are there history of bullying? You also want to look at the severity of this condition, the dyslexia. You want to look at the impact on the family. Do you know? A couple came to the office to tell me that the challenges the child was having is because the child was not taken home for the yam festival. Many of us are smiling. And the husband was accusing the wife because it was because the child was not taken for the yam festival. That was why the child was having that condition. And we know children with special needs, they will always exhibit their something. And so we are now allow the man to check the hall where the other parents are keeping their children. Now the question that was thrown to him was that, do you see some other children exhibiting the same condition, the same feature with that of your child? He said, yes, there are so many of them like that in the hall. How many of them came from your village? He said none of them came from his village. And so what are we trying to look at here? Sometimes it could create unconducive atmosphere at home for couples because the man will be accusing the wife or the wife will be accusing the husband. Or what about a situation where they believe it's a spiritual attack? It is because somebody in the neighborhood who did not visit them at the time of pregnancy is the cause of the problem. So assessment will go a long way in unraveling this situation. Then we want to know from the assessment, does he run from in the family? Is there somebody in the family who has been having this type of condition? This will go a long way in helping us to plan the intervention. Now also there are standardized psychological tests that psychologists will have to also use or administer for this individual having this condition. Do you know there are adults with dyslexia? Dyslexia is not only for children and adolescents. There are some individuals who are also adults who are having this kind of situation. So it is important to conduct a thorough assessment to actually be able to help. Now, we want to look at a very important aspect. There are issues that comes with dyslexia that psychologists, when they see, they have to do proper referral to appropriate specialists to handle it. For example, a child with dyslexia may also be having seizure, may be having seizure, what people call epilepsy. In situations like that, although it has its own emotional and cognitive component, but there is a need for a child psychiatrist or other professionals to attend to that condition so that proper management can also be taken into consideration. It is also important to psychoeducate the parents, teach the parents about the condition, how they can manage this individual in a way that it will be a healthy one for this individual. Relaxation exercise, deep breathing exercise could also be put in place to help this individual to be able to manage some stressor that can bring about increase in the severity of comorbid condition. Someone can have dyslexia, but there could be comorbid condition that could be associated. For example, somebody with dyslexia could have seizure. And whenever there is some undue stress on this individual, the seizure episode will come. So you can train this child in deep breathing to manage stress and stressful situation, or relaxation exercise that can promote calm behavior and mental wellness. It is important also to teach coping skills, coping strategies. Coping skill is very important, in which the individual will learn to manage the situation. One of the things you find among children with this condition is stigmatization. They are being stigmatized in the community, being stigmatized in school, and ability to help this individual to build coping strategies goes a long way. What about self-esteem issues? Can be identified, and when it is identified, it's important that they are managed. Now, it is important for me at this point in time to let us understand that dyslexia or individuals that are having this condition, their parents could also be trained to also help them. Early identification is very key. Early detection of symptoms, early identification and treatment go a long way. Then parents could also be helped or trained to read aloud for this child so that it will help them in learning. I have seen that among those of us that are presenting, specialists from schools are also there. So they are still going to talk more about this. It is important for us to know that there are strengths in the life of people with dyslexia. And research has shown that it is important to focus on the strength-based approach in this individual. They are very creative. They are very analytical. many of these children, they have a lot of initiative in them. And so working with these children, psychologists want to identify this area of strength and build this area in them. In building their strength, the weakness in them will be minimized. It is not possible, for instance, to remove the diagnosis. One can minimize the effect. But one thing that is important is that what are the strengths inherent in this person? What are the skills inherent in this person? And these are the areas the psychologists want to work on to build the person such that the individual will be functioning well socially, functioning well cognitively, functioning well emotionally. And at the end of the whole thing, you will have a balanced individual. And also, parents also can also be supported to help this individual achieve their dream. You can find people with dyslexia in sports. You can find them in drama. You can find them even in coding programs, science. And we are in the age of artificial intelligence now, which I am believing will go a long way in helping these children to acquire more skill on what they can do with their hands as the time goes on. Finally, dyslexia and children with ADHD, they are children with special needs. Not minding the diagnosis, psychologists are trained to look beyond the diagnosis to what are the strengths in this individual that can be promoted. Then what are the psychosocial challenges that can be minimized? And nothing being equal, it is important that these individuals are managed in a multidisciplinary approach, from the psychology to the occupational therapy to the speech therapy, from individual perspective professionals, so that this individual can function optimally. And finally, there is always strength. There is always ability in disability. Thank you, everyone. I'm very grateful.
Please, we can do better. Please let's put our hands together for him again. Thank you, Mr. Akinkunmi. There's a word that has been resonated in this auditorium, right from the keynote address even to Mr. Akinkunmi's presentation: strength. These children have strength, and we need to see how we can nurture the strength and harness the strength and bring out the best in them. So let's not give up on them. It's not the opportunity, it's not the time to give up on them. Even when we're feeling discouraged, let's help them develop coping strategies, and focus on their strengths. He said they have strength, they are creative, they're analytical. Let's look for these things and bring out the very best in them. Something else, if you see anybody about to jump a queue, the person probably has ADHD. So that time when you are about to jump a queue, just caution yourself and say, no, I do not have ADHD, I'm going to behave myself. So please, let's take note of that. Before we go to our next speaker, I'd like us to just stand up for a bit. We've been sitting for over an hour. So let's just stretch a bit. Please, let's be on our feet. We're going to do a little exercise. I know most of us in this auditorium are teachers and parents, but let's stretch. So basically, we're just going to do, I'm alive, I'm awake, I'm alert, and enthusiastic. I'm alive, I'm awake, I'm alert, and enthusiastic. So it's I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert. I'm alert, awake, alive. I'm alive, awake, alert, enthusiastic. I can't see that Bulgarian very well. You need to shake it up, shake it up. Let's try it again. We'll take it faster now. I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert. I'm alert, awake, alive. I'm alive, awake, alert, enthusiastic. Faster now. 1, 2, I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert, enthusiastic. I'm alive, awake, alert. I'm alert, awake, alive. I'm alive, awake, alert, enthusiastic. Let's give ourselves a round of applause.